The issues plaguing the troubled Betsi Cadwaladr Health Board are nothing new, but after nearly a decade of being in and out of special measures, tonight there are calls for a public inquiry into the high number of prevention of future death reports in North Wales. Analysis by ITV Wales has revealed that coroners have raised concerns around 28 cases within the board over a 16-month period. Across all 7 boards in Wales, 46 prevention of future deaths notices, or PFDs, were issued between January 2023 and April this year. You can see clearly here that Betsi Cadwaladr had 4 times more than any other health board. We'll be asking why and hearing from the families affected, some saying this is the tip of the iceberg. Our North Wales reporter Joanne Gallagher has been investigating this and is live outside Wrexham Mylor Hospital for us tonight. Joanne, we will be hearing from the Health Board, of course, but first of all this evening, can you talk us through what exactly PFD notices actually are?
Yeah, these are official ways for a coroner to raise concerns around the circumstances of a death following on from an inquest. Now, the coroners don't make recommendations, they merely point out areas of risk to try and prevent any future deaths. Now, here at the Betsi Cadwaladr University Health Board, they've had 28 of these notices in the past 16 months. That's a lot higher than any other health board throughout Wales. In our exclusive report, we've spoken to families who are involved in this, and they are seriously concerned, and they're asking for answers, not just for themselves, but they raise issues around the healthcare throughout the region, and they want to know how things can improve in the future. The families say they've struggled to get answers from the Betsi Cadwaladr Health Board, so we, in our investigations, have tried to help them with that. I've been investigating this issue with producer Daniel Bevan and camera operator Tim Ward.
Catherine was wonderful. It was a complete honour and privilege that she chose to journey through her life with me. She was kind, considerate and always focused on others, and an absolute joy to be with.
He was always the little clown in the middle of everything, very close towards you, but he would argue with his brother and sister because he wanted to be the boss. But he was, life and soul of the family.
Catherine and Tom's deaths could have been avoided, according to North Wales coroners. Since the beginning of 2023, 28 prevention of future death notices have been issued to Betsi Cadwaladr University Health Board.
To see Catherine amongst so many other people who've lost their lives, and those lives were wholly, those deaths were wholly avoidable, it is truly shocking. It's completely alarming.
When I heard about how many, I just thought, that's unbelievable. That's more than 2 persons per month that the trust is let down.
Families told us they've struggled to get answers from the Health Board, so we saw its chief executive on their behalf.
Hi, nice to meet you. Thanks very much for speaking to us. Take a seat, please.
Thank you. Thanks for coming.
What's your understanding of a prevention of future death notice?
Yeah, Betsi Cadwaladr is the health board that has probably the most prevention of future death notices, and what they do is they highlight, from the coroner's point of view, areas where care can be improved and death could potentially be avoided in the future.
Catherine, a nurse at Betsi Cadwaladr, died when her ovarian cancer was missed. Tom died when he didn't get mental health care quickly enough. His mum Bethan is also a nurse at Betsi.
Tom's inquest found that his death was preventable.
Yeah.
As a mam, that hurts. Has anyone from Betsi Cadwaladr Health Board been in touch with you or your family following Tom's death?
No.
How does that feel?
It's upsetting. I work for them also. But Tom is a number. That's how it feels.
He's not a number to you?
It's not a number to me.
The Trust's chief executive is fairly new to her post. She says she's listening now and vows to make changes.
If a situation were to happen from moving forward, my expectation is family members are involved at the start. They're part of what's happened, the investigation. They get the report, people take them through the findings, and then we share with them, this is what we've done as a result of the tragic death of your son or your daughter, your wife. That's what it needs to look like. That's what we're working on. And sadly, I can't change what's happened.
But will you commit to make the changes going forward?
I absolutely will. That's what I've come here to do.
Widower David Jones has doubts. He wants the UK government to step in.
Far too many people have died, and that includes Catherine, my wife, and also my father, as a result of failings within the health board, and as we can see behind us, very many other people.
So you feel that healthcare in North Wales is so bad in relation to Betsi Cadwaladr that you would want this public inquiry to investigate it?
Yes, we have so many deaths of people that are entirely preventable, then it would seem to me to be entirely proportionate that that is what is required.
Would a public inquiry be welcomed by the troubled Trust?
I completely understand Mr. Jones's view about trying to understand what's happened here and what can prevent things happening in the future. Clearly not my role to really comment on public inquiries. There's all sorts of legislation and other decision makers on that.
But would it help you if the UK government were to step in?
Well, often my sense on public inquiries is that they take a very long time to come. And we're in a hurry to make improvements.
For the families who've lost loved ones, improvements can't come quickly enough.
Joanne, harrowing stories, very distressed family members in your reports wanting answers. They're speaking out and they're speaking to the health board and political leaders. So what do they want to see happen next?
I think they spoke to us at ITV Wales, Andrea, because they did want some answers. They wanted to know that there would be changes following on from the deaths of their loved ones, because they were struggling to find out what was going to happen going forward. When one of these prevention of future death notices is handed out, in this case to Betsi Cadwaladr, they have 56 days to say what changes are going to be implemented. And for David, who you heard from in our report, whose wife Catherine died, and Tom's mum Bethan, they really struggled to find out what would happen in the future. So that's why they were happy to speak to us, and we spent a lot of time with them last week talking. It was very distressing to hear just how upset they were. David Jones, Catherine's widower, has spent a substantial amount of money to try and make changes, to try and make the healthcare here better for everybody in North Wales. He has, of course, called for that public inquiry. Well, Eluned Morgan is the Health Secretary in charge of health in Wales. It is, of course, a devolved matter, and while she says improvements do need to be made, she doesn't think a public inquiry is the way to go.
I'm really worried about that. This is an issue that I've discussed directly with the chair. Because most of those were issues that happened before they were put into special measures, but that's not an excuse. The key thing with these Clause 28s is that you've got to learn from them.
Health is, of course, a devolved matter. The Conservatives and the Senedd have this evening come out, following on from our report, to say they feel there should be a public inquiry. But it's very much a political football. Of course, elections are on the horizon. But at the heart of this are these 28 bereaved families who very much want answers and to ensure that no one else goes through what they have in the future.